Hey all, I'm Dr. Mike Bruner. I am a clinical psychologist and the director of behavioral health here at Health Source of Ohio. So for this video, I just kind of had the idea that I wanted to just tell anyone who's interested in our postdoc, like the first things that come to my mind in terms of what I would want you to know if you're interested in coming here. So definitely first things first, this is specifically a primary care behavioral health training experience. Everything that you'll be doing kind of revolves around the primary care behavioral health model. That involves your direct patient care. That is everything that you're going to learn in terms of working within your primary care team, collaborating with the medical team, kind of educating them on the model, and then things at a higher level too, in terms of how do you then go and implement this model somewhere else? How do you be a director of behavioral health, if you end up kind of getting that role down the line? Another big thing that I think it's important to know is that this is a brand new thing for us. We just had our first ever postdoc fellow, Idali Suarez, in March of this year, 2023. And then our second fellow will actually be starting next week, September 2023. And so, that kind of could be huge pros for you or huge cons for you, depending on what kind of person you are and like what your interests and what your preferences are. So, if you're someone who wants to come in and the whole training experience, the whole year is kind of planned down to a T, and you want it to just kind of point and you go, this probably isn't really the best place for you, to be honest. On the other hand, if you're someone who likes to be at the ground floor where the action is, if you want to be able to actively participate in building your experience and evaluating your experience and helping us innovate for future cohorts of postdocs, this is definitely the place for you. Jumping off that a little bit, primary care behavioral health in general at Health Source is relatively new. It all started with me 5 years ago. Just had my 5th anniversary here. And as you might imagine, COVID coming into the mix a couple years later really kind of threw us through a loop. The most important thing to think about there is that Health Source is an enormous organization and the behavioral health team is still pretty small. So Health Source has, I think, 19 physical locations, many of which have multiple services. So we've got family practice, pediatrics, women's health. We've opened several new school-based health centers. We've got vision, pharmacy. I may even be missing something, dental. So we're always trying to think about how can we maximize our reach. We've got a lot of medical providers kind of clamoring for our services as well as patients, while still trying to kind of adhere to the spirit of the PCBH model. One of the big ways we've done that is through virtual services. So, being able to offer those, including doing virtual warm handoffs, has been a huge thing for us over the last year or two. Another thing that I think is really important to know about the training experience here is just kind of where we are and who our patients are. So our offices are almost all in rural and semi-rural locations. Our populations are becoming slowly but surely more diverse over time, but still by far our patient populations have an Appalachian cultural influence. We are also an FQHC, a federally qualified health center, which means that we exist specifically to serve the underserved. Really take that part of our mission and our purpose very seriously. You'll see that we talk about it all the time. It's kind of influence in everything that we do. We really are proud of that. I just thought I would say a little bit about the vibe, I guess, of the behavioral health team here at Health Source, including with our trainees. I think one of the biggest things that kind of defines us as a team is that it's very kind of horizontal. I don't know the right word to use. It's very stable. We're all kind of colleagues, you know. We really take seriously treating each other as colleagues and as equals, regardless of training level or anything else. So we've got myself as a psychologist, we've got clinical social workers, we've got a postdoc fellow now, and we have you know, practicum students in clinical psychology, and even our brand new practicum students, we really treat them as an equal member of the team. You know, we really try to value their inputs in everything they bring to the team. And then probably the only other thing I would say is just that we really like to have fun. You know, if you want an example of that, we haven't done any in a while, but go look at some of our TikToks from a year or so ago, and you'll get a really good idea of kind of what it feels like to be on this team.